Hello, how's it going? How are you? I'm Dr. Federico Baena, and today we're joined by Dr. Manuel Feregrino. He's a periodontics specialist, which means he's in charge of caring for and curing everything around the tooth. And today he's going to explain to us what gum recession is. Doctor, before we start, please tell us, does it work if you brush your teeth downwards? Will the gum go back to its place?
No, it doesn't work because gum recession or gum retraction is a consequence. And as a consequence, I wish it could be reversed with a gum massage or by changing the brushing technique. Being a consequence, it needs another type of treatment.
And why does gum recession happen then?
It happens due to several factors. It can be due to brushing technique in those patients who use a hard toothbrush and also brush horizontally, like a violin. They brush so hard that, in the effort to keep themselves very clean, or they simply have a heavy hand, they brush so hard that over time they end up having this recession, this retraction of gums. It can also be due to something called occlusal trauma, which can be a malposition of the teeth, where some teeth are working more than others, or in patients who grind their teeth or clench their teeth. At the neck of the teeth, which is where the stress of the bite is most received, it causes this gum recession to occur. Another cause can be due to malposition of the teeth in teeth that are very far forward, like outside the arch, let's say, of the maxilla or the mandible, which will also have the tendency to have recessions. It can be as a complication of orthodontic treatment, because due to orthodontic movements, sometimes they have to move the teeth outwards, and sometimes that causes the gum to thin, the bone to thin. Another cause can be a periodontal infection, which is periodontitis as such, which is an infection of the gums that causes bone loss. So it remains as a consequence of this gum infection.
And that means then that if you have gum inflammation or your gums bleed, it's very likely that you have gingivitis. Is gingivitis also another cause of gum loss?
As always, the important thing is the diagnosis. You said it very well. Gum bleeding is not normal in the end, and it's already a sign of a gum infection. So the most common and ordinary one is gingivitis. When this gingivitis lasts for a longer time, this infection can continue to advance, and it becomes periodontitis, which involves a loss, of the gum attachment accompanied by bone loss. So this in the end can lead, among many things, to a recession or a retraction of the gum.
Now, if we have this problem, can it affect us in any way?
Yes, of course. It can be from an aesthetic point of view in patients who have a very wide smile, for example, who show their gums, where it's clearly seen that they have longer teeth than others because the gum moved up, it receded, let's say, right? They can have hypersensitivity problems because as the roots of the teeth are exposed, the dentin is exposed, the cementum, which is much more sensitive to temperature changes. So, for example, patients who are drinking something cold, and as they say, in colloquial terms, their teeth are set on edge, right? They have this hypersensitivity. Also, with the roots of the teeth being exposed, they could have problems with cavities, right?
Sure, it's happened to me with many patients that when the gum recedes, the dentin is exposed, and dentin is very different from enamel. Enamel is like a crystal, and dentin is a very rough surface that retains more bacteria and, therefore, cavities form. And if you have, for example, a little black dot on the neck of the tooth, it could be a cavity caused by this type of problem.
Now, we all naturally have something called keratinized gingiva. This is a band of gum tissue that surrounds the teeth. Why is it called keratinized? Keratin is a protein. It's a substance that gives resistance to the tissues. For example, a callus is basically made of keratin. People, I don't know, on our feet we develop calluses, mainly runners. People who play guitar develop calluses, that is, in areas of friction. If we did an experiment, imagine if we brushed our arm with a hard brush, we would surely end up forming a callus. So why do we need a callus in the mouth? Why do we need this keratinized gum in the mouth? Well, because food passes by, the tongue passes by, the toothbrush passes by. So imagine a case with such a large recession that all the keratinized gum is lost. What would happen in a person who suffers from this recession, who doesn't have that width of keratinized gum? Well, surely when they brush, they'll surely be sensitive in that area. They'll feel as if they were hurting themselves the moment the brush passes through that area. In fact, it's a reason for consultation that they brush their teeth and it bothers them in this part that doesn't have keratin.
So if you brush your teeth and it hurts, it could be that you're lacking keratin. It's like when we have a blister on our foot and that wound stays open. You walk and it hurts. It's exactly the same. There's no longer the keratin to protect us. Now, doctor, how can this problem be corrected?
The first thing is to know the factor that caused it, right? Going back, if it's a patient who has a hard brush and who also went at the gum with everything like a violinist, it's definitely changing the brush and changing the brushing technique. If it's a patient who is clenching their teeth or grinding their teeth, find out the cause of why it's happening and at least place a guard or a night protector if it happens that they clench or grind their teeth at night to eliminate the factor that's causing it. If it's a patient who has a malposition of the teeth, they're probably a candidate for orthodontic treatment to align their teeth and eliminate that malposition they have of those teeth. Once the factor causing this sequel of this gum recession is corrected or detected, then it can be corrected, for example, with some surgery. The general term is periodontal plastic surgery, and it's definitely going to be important to have an appointment with a professional, a periodontic specialist, to see how far that recession goes.
When you hear, for example, about graft surgery, the graft is taken from another part of the palate and moved to the area of retraction or loss to replace the lost gum tissue. Is it very common to do these types of grafts from one part of the palate to the gum?
If it's indicated, yes. It's a very predictable technique to take a part of the palate, which is very small, and move it to the area where the gum is missing. Why the palate? Because the entire palate is covered with keratinized gum tissue. It's a very good area that works as the donor site. The advantage, for example, of taking the gum from the same patient, from the same person whose recession will be covered, is that they're their own cells. It's their own tissue, which in the end will be the most compatible with their own body.
Perfect. And does this surgery hurt?
During the procedure, there shouldn't be any pain because it's done with local anesthesia. The post-op period must be very well controlled with analgesics and anti-inflammatories. Generally, we also need to protect ourselves with antibiotics. In short, I can tell you that no, the patient shouldn't have any pain after the procedure.
Perfect, doctor. Now, how much does a procedure like this cost?
Well, it depends on the type of recession, how extensive it is, how many teeth it covers, and what type of materials will be used. It could maybe range from 3,500 pesos to probably 10,000 pesos per tooth. But anyway, it depends on many factors. The truth is, it's very difficult to give an estimate of how much they'll charge you, because it depends on the extent, right?
Roughly an average between $180 up to about 500, 600, at least here in Mexico. We give the price in dollars so that anyone watching us in Latin America can make the conversion more easily. Doctor, now, do all recessions have to be operated on?
Absolutely not. It depends on the case. For example, a person with a 3mm recession that isn't aesthetically noticeable, who doesn't have hypersensitivity when drinking something cold, for example, whose teeth don't get sensitive, and who has a good width of keratinized gum, doesn't need surgery. The important thing is to determine, as always, the factor that's causing it. And if it's detected in time that, for example, the patient was causing it with their brushing, it's enough to change the toothbrush. And in any case, the key word is follow-up. Having recorded how much recession there was in millimeters and following up at 6 months, at 1 year. And if this recession remains stable, it absolutely doesn't require any type of treatment. The important thing here is that the professional you go to has to justify very well the reason why a surgical procedure is required.
So now you know, if you have any doubts, the first thing is to go to a periodontist so they can really tell you if it's necessary or not to have surgery or do some preventive procedure. Doctor, thank you so much for helping us on this channel. If you have any questions, please leave them in the comments. The doctor and I will try to answer as many questions as possible. If you like this video, give it a like and share it so more people know why this problem happens and how to treat it. Subscribe to the channel to keep seeing videos like this one. The doctor is invited to many more videos on our channel, and we'll see you in the next video. Take care.
Leaving as a consequence the exposure of the root one more time.
And why does the recession happen?
I've got the giggles.
The cut is freaking awesome. Dough. And can you explain to us why? Yes.
Go. Okay.
And can you explain to us why that happens? How awful. Okay.
It's just that I get the giggles starting at 9:45. I get the giggles and that's it.
Can you please get the giggles out of the doctor?
The first thing. Very well.
Important.
Very important. The little moaning part